Assalamu alaikum. I am Hammad Majeed from BS Biotechnology and my presentation topic is Dialectical Behavior Therapy. Dialectical Behavior Therapy. Dialectical Behavior Therapy (DBT) is a type of talk therapy for people who experience emotions very intensely. It's a common therapy for people with borderline personality disorder, but therapists provide it for other mental health conditions as well. Dialectical Behavior Therapy. Psychotherapist it based on cognitive behavioral therapy, but it's specially adopted for people who experience emotions very intensely. Dialectic behavior therapy. Cognitive behavior therapy is a talk of people talk is a type of talk therapy, but helps people understand how thought affects emotions and behavior. Mental health conditions. DBT has proven to be effective for treating and managing a wide range of mental health conditions, including borderline personality disorder, self-harm, suicidal behavior, depression, anxiety, mental health condition. It's important to note that the reason DBT has proven effective for treating these conditions is that each of these conditions is thought to be associated with issues that result from unhealthy or problematic efforts to control intense negative emotions rather than depending on efforts that cause problem for the personal. DBT help people learn healthier way to cope. How I do a DBT therapy? A therapist can be a psychiatrist, and medical doctor who can prescribe medications, psychologist, social worker, or family therapist. Finding the right therapist is often a time-consuming task, and DBT therapy isn't any different. Try not to become discouraged. Talk to people you trust to give you a referral for a therapist who uses dialectical behavior therapy, whether it's your primary healthcare provider or a friend or family member. Finding the right therapist is often a time-consuming task, and DPT therapy isn't any different. Try not to become discouraged or talk to people you trust to give you a referral for a therapist who uses dialectical behavior therapy, whether it's your primary healthcare provider or a friend or family member. You can also search for therapists online through local or state psychological associations. How does dialectical behavior therapy (DBT) work? The main goal of therapists who use dialectical behavior therapies is to strike a balance between validation, acceptance of who you are and your challenges, and the benefits of change. Your therapist will help you learn new skills to improve emotions regulation. How does dialectical behavior therapy? The structure of dialectical behavior therapy can vary some from therapist to therapist, but in general, DPD involve these four types of sessions: DBT assessment, individual therapy, skills training in groups, individual DBT therapy. Individual DBT therapy involves weekly sessions with your therapist. Each session lasts about 40 minutes to 60 minutes. Individual therapy sessions have the following goal: to help people you save by reducing societal and help and self-harming behavior, if applications to limit behavior that get in the way of productive therapy. DBT skills training in groups. In these sessions, Your therapist will teach you skills in a group setting. This isn't to be confused with group therapy, in which you discuss your problem with others. Think of it more like a teaching and learning session in a classroom setting. DPT, DBT skills aim to help and enhance your capability in one day-to-day life. The four skills your therapist will teach include mindfulness. This is the practice of being fully aware and focused in the present instead of worrying about the past or future. Distress tolerance. This involves understanding and managing your emotions in difficult or stressful situations without responding with harmful behavior. Interpersonal effectiveness. This means understanding how to ask for what you want and need and setting boundaries while maintaining respect for yourself and others. Emotion regulation. This means understanding, being more aware of, and having more control over your emotions. Telephone crisis coaching. DBT often involves telephone crisis coaching to support you and your daily life. This means you can call your therapist at certain time for support between sessions. Examples of when you may need to call your therapist include when you need help with an immediate crisis, such as wanting to self harm, when you are trying to use the DPD skills you learned but want some advice on how to do it. Benefits and risk of DBD. Dialectical behavior therapy has been proven to help people with their mental health conditions in several studies. For people with borderline personality disorder, in particular, DBD result in self less self-harm behavior and anger, fewer days of inpatient hospitalizations, less drug and alcohol misuse, improved depressive symptoms. How long will I need dialectical behavior therapy? Dialectical behavior therapy usually talks at least 6 months to a year. However, each person is unique and mental health conditions are complex. You shouldn't accept to be completely free of symptoms or no longer have problematic behavior after 1 year of DBT. When should I see my healthcare provider or therapist while doing DPD? It's important to go to all of you scheduled individual DPD therapy session and group skill training session. If you are experiencing a crisis such as feeling suicidal and can call your therapist, do so. Dialectical behavior therapy is an effective treatment to help people who experience very intense negative emotion, although it may be difficult and time consuming to find the right DPD therapist for you. It's important to keep trying. The sooner you can start therapy and stay committed to it, the sooner you will have an improved quality of life. Stages of DPD. DPD offer a common sense multi-stage approach. Stage 1 treats the most self-destructive behavior such as suicide attempts or self-injury. Stage 2 being to address quality of life skills such as emotional regulation, distress tolerance, and interpersonal effectiveness. Stage 3 focuses on improved relationships and self esteem. Stage 4 promotes more joy and relation connections. Thank you so much.